If you're over 60 and want to take better care of your health at home, you're in the right place. Welcome to Senior Vitality Podcast, where we share simple senior health tips to help you stay active and independent.
Okay, let's unpack this.
Yeah.
We often get caught up in the flashy side of medicine, the robotic surgeries, the AI diagnostics, the things that look like sci-fi.
Right.
But sometimes the most shocking information, it just comes from staring at the raw scoreboard.
Mm-hmm.
We are looking at a condition that is currently the 5th leading cause of death in the United States.
And a leading cause of long-term disability.
A leading cause of disability. It's not just ending lives, it's fundamentally altering the quality of life for millions. And yet, when you actually dig into the data, a massive, massive portion of these events are entirely preventable.
It is staggering. We are, of course, talking about stroke, and the frustration for the medical community has always been that we know how to prevent so many of them, but there's a massive disconnect between the knowledge in the lab and the actual result in the living room.
Exactly. It's like we have the map, but we keep driving the car into the ditch.
Yeah.
So the mission for this deep dive is to look at the new roadmap.
The new playbook.
We are pulling apart the 2024 guideline for the primary prevention of stroke. This is the big one from the American Heart Association and the American Stroke Association.
And it is a significant update. I mean, this is the first comprehensive guideline for primary prevention, meaning preventing that first stroke since 2014.
Chill decade.
That is a decade of science, new classes of drugs, and, changing perspectives packed into one document.
But because we like to keep things interesting here, we aren't just sticking to the official manual.
Of course not.
We found a couple of fascinating recent studies that complicate the picture, specifically regarding diet. Let's just say, if you love cheese but feel guilty about it, stick around. You might be pleasantly surprised.
But on the other hand, if you're chugging gallons of milk for health, we might need to have a serious talk. It's a classic case of nutritional nuance. We will get to the dairy paradox later because it really challenges how we think about good and bad foods. It turns out, biologically, a slice of cheddar and a glass of milk might as well be from different planets.
I can't wait for the cheese validation. But first, let's ground ourselves in this 2024 guidelines. You mentioned it's been 10 years. What's the headline here? What's the core philosophy shift?
The shift is really moving from just treating risk factors in isolation to a more holistic view. They center everything around a framework called Life's Essential 8.
Life's Essential 8. It sounds like a Quentin Tarantino movie, but I assume it's healthier.
Much healthier. It's the checklist for cardiovascular and brain health. They divide them into health behaviors and health factors.
Okay.
The behaviors are eat better, be more active, quit tobacco, and get healthy sleep. The factors, the things we measure, are manage weight, control cholesterol, manage blood sugar, and manage blood pressure.
I'm going to be the skeptic for a second. Eat your veggies, go for a run, put down the cigarettes. We've heard this for 40 years.
Sure.
Why is repackaging it as Essential 8 revolutionary?
Because of what the guidelines call the prevention gap. This is a key concept in the new text.
The prevention gap.
The prevention gap is the measurable statistical difference between our current health outcomes, high stroke rates, high disability, and what could be achieved if these 8 strategies were actually implemented properly.
So the gap is the missed opportunity.
Precisely. The guidelines state that closing this prevention gap could prevent more than half of all stroke events.
More than half.
Think about that. We could cut stroke numbers in half, not with some futuristic nanobot technology, but by actually closing the gap on these 8 things.
That is wild. More than half. So where are we failing? Is it just that people aren't doing it, or are the treatments we have not working as well as we think?
It's a bit of both, but there are some medical heavy hitters where the standard approach has been failing us.
Like what?
Take blood pressure, for instance. It's arguably the most critical factor for stroke prevention. The guidelines highlight a really sobering statistic from randomized controlled trials regarding monotherapy that's using just one drug.
Okay, lay it on me.
When you treat someone with high blood pressure with just one medication, they only reach their target blood pressure about 30% of the time.
Wait, hold on. Only 30%. So if I go to the doctor, have high BP, get a pill, and go home thinking I'm safe, there's a 70% chance I'm not actually fixed.
Correct. And that's a failure of the system, not the patient. The body has compensatory mechanisms. It fights to keep pressure where it is.
So one drug isn't enough to win the fight.
For most people, no. Most people need 2 or 3 medications hitting different pathways to actually get to the goal. So the new guideline explicitly recommends that for most patients, we should be thinking about starting with or quickly moving to 2 or more medications.
That we've been undertreating.
Simply by being too conservative. Yes.
That's a huge takeaway for anyone listening who manages blood pressure. If your numbers aren't moving, you aren't broken, the strategy is just too weak.
Exactly. And the other massive shift in the medical toolbox involves GLP-1 receptor agonists.
The drugs that have been all over the news. Ozempic, Wegovy, those types.
Right. In the 2014 guidelines, these weren't a major factor for stroke prevention. Now, the 2024 guidelines have a new recommendation. They aren't just for diabetes management or weight loss anymore.
Okay.
They are specifically recommended to reduce the risk of stroke and cardiovascular disease in patients with diabetes and high cardiovascular risk.
Is that just because people lose weight, or is the drug doing something else?
That's the fascinating part. The research suggests pleiotropic effects, which is a fancy way of saying multiple effects from a single agent.
Got it.
Yes, weight goes down and sugar goes down, but these drugs also seem to reduce inflammation in the blood vessels and stabilize plaque. It's hitting multiple items on that essential 8 list at once.
Okay, so we have the essential 8, we have better drug strategies. But reading through these guidelines, something else struck me. It feels less robotic. It feels like they are looking at the patient as a human being who lives in the real world.
You picked up on the focus on social determinants of health, or SDOH.
SDOH.
This is a major addition. The guidelines acknowledge that biology doesn't exist in a vacuum. You cannot simply tell a patient eat better if they live in a food desert or manage stress if they are facing economic instability or housing insecurity.
Right. The guidelines explicitly list things like education, economic stability, neighborhood, and access to care as risk factors. But how does economic instability actually cause a stroke? Is it just behavior?
It's biological friction. Chronic stress from financial insecurity or discrimination keeps cortisol levels chronically high. High cortisol keeps blood pressure up and increases inflammation. So these social factors literally change your biochemistry. The guidelines now recommend screening for these determinants because if a doctor ignores the context, the treatment plan will fail.
It's seeing the context behind the patient. And speaking of context, there is a massive section on women's health that feels very new.
It is crucial. For a long time, stroke prevention was very male pattern focused. This update adds sex-specific recommendations. One of the biggest takeaways is that pregnancy history matters forever.
Forever. You mean if a woman had a complication 20 years ago, it matters for her stroke risk today?
Yes. Think of pregnancy as a stress test for the vascular system.
Right.
The guidelines highlight that conditions like preeclampsia, gestational diabetes, or hypertensive disorders of pregnancy are warning signs. They increase stroke risk significantly later in life.
So if you're a woman in your 50s or 60s at a checkup, you need to be telling your doctor about what happened during your pregnancies in your 20s or 30s.
Absolutely. The guidelines recommend screening for this history. It's a red flag that you might have vascular vulnerabilities.
What else?
They also flag endometriosis, premature ovarian failure, which is ovarian failure before age 40, and early onset menopause before age 45.
These are all now considered risk enhancers for stroke.
Correct. And while we are talking about inclusivity and specific populations, there is another first in this document.
Oh.
It addresses transgender health for the first time in stroke primary prevention guidelines.
What's the specific finding there?
It notes that transgender women taking estrogens for gender affirmation have an increased risk of stroke.
Now, this is where we have to be very clear. This isn't the guidelines saying, don't do this treatment. Right?
Not at all. It is about inclusive practice. Estrogen is a known clotting factor. This is true for cisgender women on birth control or hormone replacement therapy as well.
So it's a known effect of the hormone.
Precisely. The guideline emphasizes that clinicians need to know this so they can evaluate these specific risk factors. If you are a transgender woman on estrogen, your doctor needs to be monitoring your vascular health more closely, perhaps being more aggressive with blood pressure control to offset the risk.
So it's about ensuring everyone gets the right prevention strategy.
Exactly. It's proactive, not prohibitive.
I love that. Let's move to the lifestyle stuff, the things we do every day, movement and food. I feel like exercise more is the oldest advice in the book. Is there anything new there?
There is a subtle but vital distinction. The guidelines separate physical activity from sedentary behavior.
Wait, aren't those just opposites? If I'm active, I'm not sedentary.
You would think so, but biologically they act differently. You can be what we call an active couch potato.
I feel seen and attacked.
Well, let's say you go for a 30-minute run in the morning.
Okay, good for me.
You're hitting your exercise goals, but then you sit in an office chair for 9 hours straight without moving. That sedentary behavior is an independent risk factor for stroke.
So the run doesn't cancel out the sitting.
Not entirely. When you sit for that long, blood pools in the legs, your endothelial function, the lining of your blood vessels, starts to get sluggish, and glucose regulation drops. Oof. The guidelines recommend specifically screening for sedentary behavior and counseling patients to disrupt sedentary time. You have to stand up, walk around, break the pattern every hour. It's not just about adding exercise, it's about subtracting sitting.
Okay, stand up while you listen to this, everyone. Now let's talk food. The guidelines are pretty specific here. They name a winner and a loser.
They do. The clear winner, backed by the most evidence, is the Mediterranean diet. Specifically, one supplemented with nuts and olive oil.
Delicious. And the loser.
Low-fat diets.
Really? I feel like the 90s just called and is very angry. Why is low fat out?
Because when people cut fat, they usually replace it with refined carbohydrates and sugar.
Ah, the Snackwell's effect.
Exactly. The guidelines state explicitly that low-fat diets have had little impact on reducing stroke risk. It turns out the quality of the fats, olive oil, nuts, avocados, is protective. Stripping out fat entirely removes that protection and often creates insulin spikes from the replacement carbs.
This is a perfect segue to our deep dive twist. We've established the Mediterranean diet is good, but let's zoom in on dairy. The guidelines are general, but we pulled 2 studies that get really granular, and honestly, they are a bit confusing.
It is complex. We have one study that says cheese is a hero and another that says milk is a double-edged sword.
Let's start with the good news, the cheese study. This was a Mendelian randomization study published in 2025. First, just quickly, what is Mendelian randomization?
Think of it as nature's randomized trial. In a normal diet study, it's hard to tell if cheese makes people healthy or if wealthy people just eat more cheese and also have better health care.
Right, correlation, not causation.
Exactly. Mendelian randomization uses your genetics. Some people are genetically predisposed to consume more cheese. By looking at their outcomes, you remove those external confounding factors like wealth or lifestyle because genes are randomly assigned at birth.
Got it. So what do the genes say about cheese?
It was a clear win. Cheese consumption was associated with a lower stroke risk. The odds ratio was 0.715, so roughly a 28% reduction in risk.
That is a significant reduction. Did they explain why? Because usually we think cheese equals salt and saturated fat, which equals bad.
They looked at 44 different biomarkers in the blood to find the mechanism, and the biggest factor,
What was it?
diastolic blood pressure. People who are genetically predisposed to eat more cheese actually had lower diastolic blood pressure.
Cheese lowers blood pressure. That
Yeah.
feels wrong. But I want it to be right. How is that possible?
It's counterintuitive. But the leading theory is that cheese contains bioactive peptides. These are specific protein fragments formed during the cheese-making process that act almost like natural ACE inhibitors.
Like a mild blood pressure medication.
Exactly. Additionally, the calcium in cheese binds to fats in the cheese matrix, which prevents the fat from being absorbed in a harmful way.
Okay, so cheese is back on the charcuterie board. But then we have the second study, the Swedish longitudinal study from 2022.
Right.
This was massive.
Yeah.
Almost 80,000 people followed for 17 years. And this is where things get tricky with milk.
Right. And Sweden is the perfect place to study this because they consume a lot of milk. The study is crucial because it separated the types of stroke. We often just say stroke, but there are 2 main kinds. Ischemic, which is a clot,
Blocking a vessel?
and hemorrhagic, which is a vessel bursting and bleeding.
And milk affects them differently.
Drastically differently. For ischemic stroke, the relationship was nonlinear. Drinking a little bit of milk, so a moderate intake, was actually slightly protective compared to drinking none.
Okay, so far so good.
But for hemorrhagic stroke, the bleeding kind, it was a straight line up.
Meaning the more milk you drink, the higher the risk.
Exactly. More milk equaled higher risk of bleeding in the brain.
That is scary. Why would milk cause a brain bleed?
This is the expert synthesis part, and it comes down to a trade-off. Milk lowers LDL cholesterol.
Which is usually good.
It is good for preventing clots. Less cholesterol plaque means fewer blockages. Hence, the protection against ischemic stroke. However, you actually need some cholesterol for the structural integrity of your cell membranes and blood vessel walls.
So if it gets too low, the walls weaken.
The walls can weaken, but there's another villain here, galactose.
The sugar.
Yes, milk is high in lactose, which breaks down into galactose. In animal models, Chronic exposure to galactose causes oxidative stress and chronic inflammation.
So it's like rusting the pipes.
That's a great way to put it. So you have lower cholesterol, which means maybe thinner walls, combined with oxidative stress, which is rusting the walls. Eventually, under pressure, the pipe busts.
So you're clearing out the pipes, but you're also eroding the pipes. That is a terrifying image.
It highlights that you can have too much of a good thing.
But wait, cheese is made of milk. Why did the cheese study show protection while the milk study showed this bleeding risk?
That is the cheese paradox, and the answer is almost certainly fermentation.
Fermentation.
The Swedish study also looked at fermented milk things like yogurt and sour milk. They found no association with stroke risk either way.
So fermentation changes the game.
It does. Fermentation bacteria consume the sugar. They eat the lactose and the galactose. So when you eat cheddar or yogurt, you get the nutrients, the calcium, the protein, the bioactive peptides, without the high load of galactose that might be causing that oxidative stress and vessel weakening.
Cheese is fermented, milk is not.
Exactly.
This is fascinating. So a glass of fresh milk is biologically very different from a slice of cheddar, even though they come from the same cow.
Completely different biochemical impacts on your body. Processing matters.
So bring this all back together for the listener. We have the 2024 guidelines, we have the cheese victory, and the milk warning. If I'm heading into a doctor's appointment or just planning my week, what is the actionable advice here?
First, go back to the source, the AHA guidelines. Ask your doctor for a formal risk assessment. The guidelines say this is beneficial every 1 to 5 years for everyone aged 40 to 79.
Know your numbers.
Know your numbers for the essential 8. And don't just check the boxes.
Meaning?
Don't hide your history. If you had preeclampsia 20 years ago, mention it. If you are taking hormones, mention it. These are risk enhancers. And if you are on blood pressure meds and your numbers aren't down, ask if you need a second agent.
And on the movement front.
Don't just count your gym minutes, count your sitting minutes. If you have a desk job, you need a strategy to stand up and move every hour. The gym doesn't immunize you against the chair.
And finally, the diet.
The Mediterranean diet is the gold standard. Lots of plants, healthy fats. Regarding dairy, based on the new evidence, cheese seems to be a safe, potentially beneficial part of that diet in moderation. Yogurt seems neutral to good.
But the milk.
But if you are an adult drinking large quantities of liquid milk, multiple glasses a day, you might want to reconsider that habit, especially regarding the risk of hemorrhagic stroke.
It's not about demonizing a food, but understanding the mechanism.
Exactly.
This has been such a dense but incredibly useful deep dive. I feel like I have a completely new checklist for my own health.
It empowers you to take control. Stroke is preventable. That's the message.
Before we go, is there one final thought you want to leave our listeners with? Something to chew on?
I think the milk study opens up a huge door for the future of medicine. We saw that a single food milk could be protective against one type of stroke, the clots, but risky for another, the bleeding.
Right.
This suggests that the future of prevention isn't just eat the superfood, it's going to be eat this based on your specific biological vulnerabilities.
So my diet should be different from your diet.
Potentially. If you are genetically prone to clotting, your diet might look different than someone prone to bleeding. We aren't there yet, but that is where personalized precision nutrition is heading.
That is mind-blowing. The idea that there is no universal healthy diet, but rather a healthy for you diet.
It's the next frontier.
Well, until we get those personalized menus, I'm going to stick to the essential 8, stand up a bit more, and maybe enjoy a nice piece of sharp cheddar. Thanks for guiding us through this.
My pleasure.
And thank you for listening. Take these guidelines seriously, close that prevention gap, and stay curious. We'll see you on the next deep dive.
Thanks for spending this time with Senior Vitality Podcast. Take care, and we'll see you in the next episode.